So thank you guys for joining us for the presentation tonight. And it is going to be all about implants, and that would be dental implants. So I hope you're on here for that. And we'll go ahead and get started. But as Jason said, my name is David Kirkpatrick. I'm a oral and maxillofacial surgeon here in Lakeland, Florida, and I am board certified, which is important. We're going to talk about that a little bit in a couple minutes on slides, but that is a very important thing for you guys to know. Whether you're seeking treatment elsewhere or you're coming here to see me, make sure that the person that's treating you is board certified. All right, so a little bit about myself. I did go to University of Kentucky for all of my school except residency, which I did at the University of Florida in Jacksonville. And as I said before, I am board certified, which is kind of how we gauge and make sure everybody's keeping up to a certain standard and a level of treatment that you as the patient would be ultimately receiving. So that's important for you guys to know that. And as we go on, so dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you at home that do not know what an implant actually is, because we do get some confusion and some questions occasionally when I see a patient in the office. You know, a lot of patients think like the implant is the tooth, but an implant is actually the supporting structure that goes into the bone, and they're all different shapes and sizes. The ones we use do look like tooth roots, and they're threaded like a screw. So basically the screw that you see on the picture is the implant. And then the restorative dentist, if you're having a single tooth made, would put the tooth on the top, or if you're seeing us for the full mouth replacement, which is going to be what the bulk of this talk entails, we would do the bridge on top of the implants. And this is how that's done. So usually with the lower jaw, I place 4 to 6 implants, and they're angled in different fashions like you see on the screen, but they're placed strategically to give you the most support with using the most amount of bone that I can in each patient's selective case. And here's how those bridges are secured to the implants. So it's one big bridge, and it's connected to all the implants with these small titanium screws. So it's non-removable. The patients can't take them in and out. They're as close as you can get to having your natural teeth back for patients that need a treatment like this. So it's a very, very good option and night and day difference from like a partial or a denture or anything else removable. So we'll go through quite a few before and after pictures because I think they do a really good job at showing you what we can achieve with these implants. So, you know, this is a patient, if you look at this guy paying attention to his mouth, he's got a lot of missing teeth, broken teeth, decayed teeth. He's even got like an abscess on the front part of his gum tissue. So, Jason, for a mouse, can I use that? Okay. Oh, yeah, it's working. Okay, so, and if you look, you know, I was trying to use a laser pointer on my screen, which you guys could not see at home, obviously, so I need to revert to this mouse. But if you look really close at that, that is an abscess coming through the gum tissue. That's, you know, basically from the root of the tooth, eating its way through the bone, then the gum, and it drains into his mouth. But, you know, so a lot of things going on, and we were able to basically bring him in one day, take everything out, get rid of the infection, put in implants and new teeth same day, and that's his before and after. So just a huge difference. And we can even change the relationship with the, basically with the cosmetics, but the relationship of the teeth with the gums, teeth with the lips, teeth with the musculature, and how patients smile. So before he had that really gummy smile, and now his teeth we're able to obtain them at a level. When he does smile, it just shows a nice level of the teeth. And that's what he wanted as well. He wanted to get rid of the gummy smile. So it's a huge difference between his before and after. Another patient, she had an unfortunate auto accident as a teenager, broke off several teeth and had some type of partial that snapped in over the remaining teeth. And it's something that she didn't like. She never wore and could not eat anything that she wanted really with the partial. So we were able to take out the remaining roots, the remaining teeth, clean everything up, put in implants, and that's her before and after. And that's in one day, just like this picture shows. And that is something that, we pride ourselves on doing, where we can do all the surgical procedure in one day, and patients walk out of our office with implants in and teeth screwed into the implants in one day. So why do patients do this procedure? Number one should be, and in our minds it is, to restore total body health, definitely improve self-confidence, brings out a smile, improves your ability to eat. You are asleep during the entire procedure, and the postoperative pain level, it should surprise you. It does us on a daily basis. We give narcotics out that we think should be enough to cover your postoperative pain level after a procedure like this, and it always surprises us when patients walk back in and they'll tell us, like, hey, you gave me 28 narcotic pain pills and I needed one. Like, I took one pain pill and then Advil or Tylenol was sufficient. So that's kind of how it is with most of our patients. I think there's some good reasons for that, but if you think about the procedure that we do, where we're taking out teeth, putting in implants, and putting new teeth on the same day, it does surprise us. And there's a lot of good reasons for that, and there's some things that we do. But I always tell my patients in consults, if you had a twin and I was taking out all their teeth and they were getting dentures, and you were taking out all your teeth and putting in the implants and the screwed in teeth the same day, you're going to need maybe 1 or 2 pain pills, where they would need probably the entire bottle, and they may come back and ask for a refill. And that's just the way it is with this procedure. The way we smooth everything, the way we attention to detail to get rid of all the infection and place the implants, and the implants are supporting the teeth that we put on that same day, takes the pressure off the bone, takes the pressure off the gums. And that's one of the big reasons that this does become more of a pain-free procedure for a lot of our patients. So that's one thing just to keep in the back of your mind for people who are really scared about how they're going to do after, or their pain tolerance is not very good and they're scared about the pain. It's really not that bad with this procedure. And the oral body connection, patients need to think about that and keep that in the back of their mind, because the mouth is the gateway to an awesome creation. And we all know, and the more literature comes out that talks about periodontal disease, and it used to relate it to only like cardiovascular system, but now we know that it's related to increase your chance for a heart attack, increase your chance to have a stroke, diabetes, osteoporosis. You can read this list of things, but ultimately what happens is the longer you have periodontal disease, which is gum disease, and it's where you get this infection around the root of a tooth, and that infection sits there and kind of brews around that root of the tooth, and it gets intertwined in the ligament that's holding your root in, and then it spreads to the bone, and then it spreads to the gum. So what you get is your bone starts to shrink down, then your gum follows, so your gum recedes. And the bad thing about that is it can be painless. Most patients don't even know they have periodontal disease until all of a sudden a tooth becomes loose. And then they go to a dentist, and then they've got these pockets around the teeth. And those pockets slowly over time get deeper and deeper, and may even start drainage. You may have drainage or a bad taste or even a foul odor from the mouth. And that's typical of periodontal disease. The cool thing about periodontal disease is the day we take out the teeth, that day it's cured. So I take out the teeth, clean up the infection, and the periodontal disease is gone. So that's one of the good things about this procedure. And if you look at this picture on the screen, this is showing periodontal disease. You know, he's obviously missing one of his front teeth. But if you look closely, you know, you can see the crowns of the teeth, and then you can see that darker, yellower material. Well, that's the root. That's where the bone is shrunk down from the periodontal disease and the gum receded after. So you start to see some of the roots. Now, the bad thing about this situation is now those exposed roots, they are sensitive. So, you know, this patient, and it's common for patients to tell us that when they get in this, you know, situation where, well, gosh, I can't really eat anything really sweet because sugar seems to cause pain. I can't drink anything really cold because cold liquids or cold foods cause pain. I can't drink my coffee hot anymore because any really severe temperature, whether it's hot foods or liquids, cold foods or liquids, really sets these off and is sensitive. But the day we take those out and the day we put in implants, like you see here, the periodontal disease is cured. And, you know, this is a beautiful picture to me. It may look a little weird to you guys at home, but, you know, the teeth are out, the infection's gone, the gum is stitched up, and you've got healthy implants. That's what it looked like about a couple of months after the procedure. And I put this in to show you. That's pink, healthy gum tissue around all those implants. No more inflamed tissue, no more red tissue, no more infected tissue. That is completely healthy. And that's his before and after. And that's a pretty big difference to go from a mouthful of periodontal disease in one day to healthy gum tissue with new teeth that he picked out, by the way, on those implants. So if you want to be truly healthy, you must restore your oral health. And I've got a video of a patient that I treated, and she kind of goes through that on a personal level. And I think it's cool for you guys to see this and just kind of go through the experience as she tells it.
I have teeth loss on this side, a couple down here, over here, and then a lot of them are decay. My whole mouth is just basically coming apart. I'm anxious to be able to eat again. Since I've been to New Teeth now and had the procedure done, I feel a whole lot better. I've kind of changed inside. That made me change the outside. So we did the teeth, kind of cut the hair. You know, I've done a few other changes that a woman just won't tell you that she's done. It's just been the best thing that could have happened to me. I can now eat. I'm not having the sinus infections that I've had. This has been pain-free. I'm getting out, I'm walking the dogs. I'm out enjoying life with friends. My husband is very thankful. We're now out back riding our Harley motorcycle. Best thing that could have happened to me. If you're afraid, if you're scared like I was, give it one shot and go. New Teeth now will change your life forever. But you have to take the first step. You're not going to be disappointed. I've been there and I've done it, and look where I'm at now.
Okay, so I think she does a really good job of kind of walking through how periodontal disease affected her. And, you know, just it is important for people to keep that in the back of your minds and address it. You know, whether you come here to get treatment, you do not want to have a mouthful of periodontal disease for a long time, because we do know, and it's documented, that it does affect the rest of the body. And we did have some questions that came in that I do want to answer, and use this time as a reminder as well. Don't forget what Jason told you at the beginning of the presentation, and if there's anybody that's joined the presentation, you can ask me questions and I'll answer them live on the air on Facebook. So make sure you submit those. But we had a couple questions,
Yes, the first one, this person would like to know about, they've heard that it normally takes 6 months for the implant to heal before you can place teeth on it, so they want to, maybe you can explain the difference.
Yeah, no, that's a great question. And it does. You're right. You heard correctly that it does take 6 months for, especially with single teeth. So if a patient comes in, they're missing one tooth. And, we take the tooth out or the tooth is missing and we just put an implant in. Once we put that implant in, we do typically, it's about 3 months in the lower jaw before that implant's ready to have the crown placed, and 4 to 6 months in the upper jaw before the implant is ready to have the crown placed. The game changes when we're doing an entire jaw or the entire mouth. The day we put the implants in, I can put the bridge screwed into the implants same day. Now, the way we do it, and which I think is by far the best way to do this, is the teeth that we put on the same day, they could be your permanent teeth, but we do 2 sets of teeth. We do a temporary set, which we put in the same day, so you get your temporary teeth on the same day, and then you wear those. They're like your test drive set. And I love that scenario, that analogy that one of my implant coordinators used. They call them like your test drive set, because that's what they are. So while the implants are healing and fusing to your bone for 4 to 6 months, you wear them and you basically get to test them out. See what you like about them, see what you don't like about them. And if there's anything that you want to change as far as the way they look, to the way they feel, to their position, to small teeth, big teeth, you can change anything going to your final teeth. So it does take the 4 to 6 months for the implants to heal, but you're able to get the temporary teeth on that day because they're all tied together. So that's called cross-arch stabilization. And I'll show you, one of these, it's very difficult to see this, and maybe, Ted, you can zoom in on this. But the way this is made and the way that it's secured to the implants, if you see those 6 little holes going through, so it's screwed into the implants. So when this is put in a patient's mouth, screwed in, the implants on this side, they're connected via the bridge all the way to the implants on the other side. So when you chew over here, the force is evenly distributed across the arch, and that's called cross-arch stabilization. So by doing that, we put you on a softer diet for 6 months. But when you're chewing on the right, the force is evenly distributed across all the implants. You're able to get the teeth on the same day. So the trade-off for me putting the teeth on and giving you the benefit of having teeth from day one is you give me a soft diet for the 4 to 6 months. And it's nothing bad. It's not like you're on liquids. It's anything that you can easily cut with a fork. The only thing I ask you to stay away from is things like steak or pork chops. But you can do chicken. You can do pretty much any type of seafood, pastas. There's a lot of things you can eat. And it's cool that you can do that because you get the teeth on the same day. The main reason we do, and I know there's another question, but the main reason was we do the 2 sets of teeth, because there's other people that put your teeth on the same day, your final teeth on the same day or in 24 hours. And in my hands, in my experience, I don't know how they do that and can make their patients happy, because we all know that your gums shrink. So after I put your implants in, your gums, if this is your gum level and this is your bridge, the day I put your temporary teeth on, they're kind of kissing the gum tissue. But as you heal over the next 2 to 3 months, your gums are going to shrink. So you're going to develop that little space in between your bridge and your gums. And you're going to come back and you're going to tell me about it and you're going to complain about it. And I'm going to tell you, I know that. Remember, we talked about it during the consult. I told you about it on the webinar. That's what the final teeth do. They close that space again, which if you don't wait, 4 to 6 months, then you're never going to close that space and you're never going to be truly happy with your final product. That's why we do that. So not only do you get the benefit of changing anything you don't like about the appearance or the feel, but we close that space, that gap between the bridge and your gums. And that is really, really important for you guys to understand. When you're coming here to see me for a consult, and why do you take 4 to 6 months to give me my final teeth? Where there's another place that can put on my final teeth in 24 hours. Well, that's why. And what will happen is you're not going to be happy with that space, and you're going to go back and they're going to say, oh, we can remake your teeth and charge you more money to do this. You just need to keep that in the back of your mind. That is something that we see all the time, and we remake from places that have done it, where they put in the final teeth, in 24 hours, and our lab remakes them for patients. So just keep that in the back of your mind. And another question?
Another question that came in relates to eating as well, and they wanted to know if they had to fast the night before the procedure.
Well, you don't really have to fast for very long, but we ask you to have nothing to eat or drink after midnight. So, you can definitely have dinner and you can eat up until midnight the night before, but it's basically an outpatient surgical procedure, so the same as it would be for any other outpatient surgery procedure. From an anesthesia standpoint, it's not really safe to have anything to eat or drink after midnight the night before. And the reason we say after midnight, the true answer is 6 hours, but we start around 7:30 in the morning. So unless you want to, push it till 1:30, you could do that, but we just make it easy and it's nothing to eat or drink after midnight.
The next question, this person I think is looking for some clarification. I know you talked some about single teeth implants as well as full mouth, and they want to know, is a secondary visit necessary for a test drive tooth on a single implant?
No, because the way that they're temporized is a lot different. So with this full arch, when we're doing everything, your temporary teeth is basically that big bridge that's screwed in. And with a single tooth, usually if you do have a temporary tooth placed, it's usually a flipper or something called an Essex temporary. So it's a removable. So it's not connected to the implant. So there's no real secondary visit, except I do see you, like for instance, on a lower implant. I put the implant in. I see you in a week to make sure everything looks good, healing good, no infection. And then if everything looks good then and you're doing a good job keeping it clean at home, then I would see you for a lower implant about 3 months, 2.5 months to 3 months after I place it, to make sure that the gum looks good, and I take a final x-ray and make sure that the bone around the implant looks adequate. And if everything looks good, then I send you back to your restorative dentist and they start making the tooth. And then, if it's an upper tooth, it's 4 to 6 months after I do the same. But it is a little different. Usually there's not a test drive temporary for an upper tooth or a single tooth.
And the last question I have right now is related more to as you go into the presentation, but maybe you can explain later on the difference between the zygomatic implants and the regular implants.
That's a great question, and we are definitely going to get to that just a few minutes on a couple slides. So just kind of be patient and bear with me on that, and we will definitely get to that. So who's a candidate for these procedures? Well, if you have no teeth, you're obviously a candidate. If you're unhappy with your dentures, you're a candidate. People who have a mouthful of bad teeth, people who have severe periodontal disease. And, this one, we see a lot of patients just every week that have been to another oral surgeon, another dental provider or specialist, and, they were told that, well, you don't have enough bone for implants. And a lot of these patients, just take that, as truth, and they kind of go for years thinking that they're not a candidate for implants. And I can tell you that I've been here for 12 years, and I have yet to meet a patient that did not have enough bone for me to do this, or a patient that I couldn't somehow do this procedure on. And there's ways that we get around, some areas that don't have enough bone or not a lot of good bone. And as Jason mentioned, he mentioned the word zygomatic implant. That's one of them. Used to patients, if they didn't have enough bone in the upper jaw, they would need, sinus lifts and bone grafts, and you let those heal for 6 to 9 months or longer. And then if enough bone took, then you come back and you put the implants in. Well, Zygomatic implants have totally changed the game with that. And it's a huge benefit for our patients and us as the treating surgeon. It's something that we can still do everything in one day by placing the zygomatic implants in the back part of the upper jaw. And that is, so your zygoma is your cheekbone, which is this bone, and those zygomatic implants anchor into the lower part of the cheekbone, which is basically what you see, my depression of my finger there. And so it bypasses the areas that you don't have enough bone. So it's a huge benefit and kind of added thing that we have in our armamentarium to help our patients, especially the patients that have been told in the past they don't have enough bone for implants. So, and this is one of those patients that did not have enough bone and had been frustrated with the dentist, frustrated with, other specialists that have told her that, you need all your teeth out and you don't really have enough bone for implants, so you need a denture. So she just kind of gave up hope and kept what she had and postponed having any treatment done until she was kind of at her wit's end and pain, and was, she was a school teacher and she's basically getting made fun of by her students, and they were young kids. And if you want to know the truth about something, ask a kindergartner, because it's a no holds barred, no filter, and they'll tell you what they think. And they were asking her, like, why are your teeth black in some areas, or why are they stained, or why they look this way? And it really affected her. And she came in and she was a complex, complicated case, and I had to really put my thinking cap on. And Ted's kind of helping us with the camera and switching back and forth with the slides and back on me tonight. And he was here and helping. She was on camera and she was filmed during part of our procedure. And I remember him asking me, like, well, how was the case? And I just remember saying it was, to that date, that was the hardest case that I'd ever done. And because she had a lot of missing bone, a lot of infection, and by the time we got it cleaned out, there wasn't a lot left. But at the end of the day, with our new teeth now procedures, that's what she ended up with. Basically a whole new, she got to push the reset button and had new teeth secured on implants, and infection gone, pain gone, black teeth left, no stains. And if you look at her, that looks incredible, the difference between her before and after. And you're talking about making a change in just a patient's day-to-day, perception of their self, was huge for her. And this another lady, her teeth don't look that bad on the picture on the left, but it's a denture, and she hated it. She hated having to take the thing out, clean after she ate, seeds and different food particles getting stuck up underneath the denture, and then she bites down on it and it hurts, causes pain. So she wanted to get rid of her denture, and she was another patient that had been told that she didn't have enough bone for implants. Just, sorry, you need to get used to your denture, buy more Fixodent. And she came to see me, and she was really skeptical about if what I was selling could work for her. And it did. That picture on the right, that is a screwed in bridge on implants. So nothing covering the roof of a mouth, no wings going up and underneath the cheeks or the lips anymore. And, nothing where seeds and food particles could get stuck and cause pain when eating, or have her, needing to go to the restroom to wash her mouth out, after she ate. She's got a fixed bridge and just a huge difference. Another patient, and I put this in, if you look at his blue t-shirt, and there's not a blue t-shirt. So this is an updated picture that I did put in here, and this is actually his final. So that is about 5.5, 6 months later, and those are zirconia teeth, which is what our final bridges are made of, and that's important for you guys to know as well. But that's just, you look at the difference between his before and afters. It's just a huge difference. Zygomatic implants. You know, if you look at this lady, she's got a denture on the top and a snap-on denture on the bottom that with failing implants on the bottom. And, you know, with her, if you look at this, let me grab the mouse again so I can try to show you this. Because if you're not, for me, and you know, if you're a dental specialist, you can probably look and it's easy to see. But that's the ridge right here. That's where the teeth would be. This is the roof of her mouth, the palate. So this part of the gum should be hanging way down here, all the way around. And you should never be able to see this in this picture. The reason you can see that is all this bone has resorbed. The teeth came out, probably from periodontal disease, which resorbed some of the bone. Then the teeth come out and the bone just shrinks up. And there's literally no bone there in the upper jaw. So she either has to be content with her denture. If she went to see someone else, which she did, she was told that she didn't have enough bone and just to get used to her denture. Or if you come to see me, you're getting zygomatic implants. Or you could have some type of extensive bone grafting, which I don't do anymore because zygomatic implants have become so predictable and, you know, fairly easy to place that they're just a game changer for a patient like this. So what do? I put in zygomatic implants, and that is a fixed bridge screwed in that non-removable. She can, once she got her final bridge in, she can eat anything she wants, and those teeth are rock solid. A new patient, you know, another patient with, you know, needs zygomatic implants. She's got great bone in the front part of her upper jaw, but in the back part, her sinuses dropped, periodontal disease ate away some of the bone, and that's what it looks like. So if you look at this picture, those are zygomatic implants, those two implants in the back, this guy and this one. So if you look, this is the sinus. This is the sinus. So your sinus wall comes down and then drops way down back here. Well, if you look at the size of this bone and this implant, that's a pretty big implant and a lot of bone. That's great. Back here, hardly any bone at all. So I anchor that into the lower part of the cheekbone, and that's the result we're able to obtain with those zygomatic implants in one day. So do we have any other questions that came in that I need to address at this point?
Not right now.
Or keep going. So the New Teeth Now Total Facial Makeover. If any of you remember the show that used to come on where they would do like a full body makeover, you know, total transformation, that's basically what we can do with the New Teeth Now implant system. And, you know, another part of my scope of practice here is facial cosmetics, as well as trauma and pathology and a lot of other things. But I do a lot of facial cosmetics, and that's something that sometimes we can do those at the same time as this procedure. So you can literally walk in with a mouthful of bad teeth, and we can take the teeth out, put the implants in, and maybe do like upper eyelids or liposuction of the neck, or you know, something with the nose, or you know, some adjunctive procedure that with this New Teeth Now implant procedure. So we do Botox, fillers, lip augmentations, chin and cheek implants, brow lifts, eyelid enhancement, facelifts, neck lifts, and rhinoplasties, which is nose job. But you know, these are just adjunctive procedures that sometimes we can do the same day. Sometimes it's better to wait and do it, you know, a month or two after. But it is something that can really make a big difference. And another procedure we can do that we can do at the same time is a carbon dioxide or CO2 laser resurfacing. And that's what I'm going to show you on this picture. So this lady came in, and she was only here to talk about implants, but then she saw one of my brochures, and she figured out that I do facial cosmetics. And you know, she asked me what she could do about these fine lines and wrinkles and sunspots. And it's a perfect candidate for a CO2 laser resurfacing. So in one day, took out all of her teeth, cleaned out her infection, put in implants, put in new teeth, and did a CO2 laser resurfacing. So she basically got new skin, got rid of her periodontal disease, and new teeth in one day. So that's a huge difference because, that picture on the right looks like the lady on the left, younger sister. It's just a big difference, and it's healthy skin. The fine lines and wrinkles, they didn't completely disappear, but it's a big improvement. And most of those pigmented sunspots, especially for, we live in the sunshine state. So people do get, some people call them age spots, or, those pigmented areas that just from years of being out in the sun, freckles, and the CO2 laser pretty much just wipes those out and lets you kind of have that fresh, new, younger skin appearance. Another patient, and this is a facelift. And if you look, not a huge difference in, where she looks like she's been stuck in a wind tunnel or her skin is stretched really tight. I want it to be a natural appearing look, but just her neck, just pay attention to her neck. There's a big difference just in the youthful appearance of her neck. Another patient, look at the neck, look at the eyes, look at the cheeks. And if you look at her profile, that's a huge difference. But she still looks natural and refreshed. And, it took off 20, 25 years. CO2 laser before and after. This is a chin implant. If you look at the before picture, she's got those little rippling and dimpling in the skin. That's because that's a muscle where she's trying to strain to close her lips. And that's because she doesn't have chin support to support the lips and the muscle. So put in a chin implant. It's a 30-40 minute procedure that makes a huge difference before and after. So dental implants, and I've had patients ask me this before, they're not going to decay and they're not going to need a root canal because they're fake. So once we take all the teeth out and put these implants in, then you're pretty much done with typical dentistry where, and when I say that, I'm talking about going in every, year and you go in for an exam and they find a decay cavity here, you get the cavity filled, you have the, you go back in a year, there's decay there again, you got to get a crown, then you need a root canal, and then you need another crown, and then you need the tooth out. Well, once you've gone through that enough, then it's time to just make the call. Take the teeth out, especially with periodontal disease, put in the implants, and you get these bridges put on, and you're out of that loop. You're done with the dentistry. Now, the maintenance on them, there's still maintenance and we go over that pretty thorough with you when you're here for your consult, especially when you come back for your procedure and your follow-ups. But it's basically what I do. I brush my teeth in the morning, brush them at night, water pick, and then every 6 months I go get my teeth cleaned. Every 6 months, you need to go get these cleaned. Because if you don't have something that you can take out of your mouth, like this big denture, and wash it under sinking water with soap and scrub it, then you have to go get them professionally cleaned. Because these, you can't take them out. Only a dentist can take them out. And when you go back to get them cleaned, it doesn't get any easier than what you'll go through. Because you don't have to sit and let a dentist scrape on them like they do with natural teeth. They basically unscrew them, take them out, take them in the back, get the calculus off if there's any accumulated, steam clean them, which knocks off any of the stains that's accumulated, and they're basically detailed and they look brand new again. Put them back in, you're done. You go, see you in 6 months. And that's the maintenance on them. So they're very easy to maintain. Another before and after, and I love some of these pictures and these patients because we get to know you on a personal level because you are, you're our patient for 4 to 6 months while these things are healing. And then we turn you over to a restorative doctor, but you're still here. You're inside this building. And so we get to know you on somewhat of a personal level. And I love seeing pictures like this where, it's just a huge difference, and it makes a big difference in these patients' lives. So this I kind of touched on, but this is important too. You're not going to come to me for a consult, go to see a general dentist or a restorative dentist at another office for impressions and to have everything set up. You're going to have your consult here, your impressions here, your surgery is going to be here. Your teeth are going to be made in this building, in our in-house lab. That's your temporary set and your final set. And trust me, there is nothing better, and it doesn't get any better than having the ability of the lab technicians that's going to be looking at you and making your teeth to actually come out and see you, in like life, see you there with not just a picture. They're looking at you. They're looking at your face, how it moves when you smile, how much you smile, how big you smile, how wide you smile, because that makes a big difference when they're sitting there making your teeth, and how much, gosh, you need a really big smile, or to cover, because you have a really broad smile, and your skin tone, to know the color of your skin and the shape of your face. It makes a difference on what teeth they're picking out, because trust me, there is hundreds of different molds, from square boxy teeth to narrow teeth to oval teeth to rounder teeth. And then colors, it's anything you want. I mean, you get to pick the color. So the procedure is done in just one day, and you do get the temporary teeth on. We talked about that. The temporary teeth are made of acrylic because they're easy for us to adjust, which is important during the recovery or during the initial healing. And then the final teeth, or your permanent teeth, which are made about 4 to 6 months later, are made out of zirconia. And that is the best material that we know of to make your final teeth out of, from a strength standpoint and a cosmetic standpoint. So when you're here, your initial visit is a consult. And if you're on this, watching this webinar and spending a Tuesday afternoon listening to me talk about implants, you at least have some interest in this. I would encourage you to somewhat, just call, make an appointment for a consult, because you can come in and we can just go through your specific situation. We get a CT scan during the consult, and when I can look in your mouth for a clinical exam, and I see what your condition is from an oral health standpoint, see your teeth, see your gums, and then we look at your CT scan together. That information is just an enormous amount of information that basically lets me in about 30, 45 minutes with you, treatment plan your entire case. And when I say treatment plan, like, you're seeing exactly what I'm looking at on the CT scan. You know exactly where I'm planning on placing the implants. And basically we talk about even specifically what size implants. So not only how we're going to do it, where we're going to place them, but in detail with the size of the implants. So, it's a pretty cool appointment, and at least, you get the information of, how we can do this. Any other questions?
Not at this time.
So, our implant coordinators, this is Shauna and Debbie. Definitely call if you're interested. Schedule a consult. You'll get to speak with one of them, and when you come in, you'll meet with me and one of the implant coordinators. But I would definitely encourage you to do that. And next slide. So this is one of our restorative doctors that I work with a lot on these cases. That's me and Dr. Nafala. He is very good at this, about helping you pick out, the teeth that you want for the temporary set, the final set, and just kind of help guide you through this. This is me and my team. These are all my surgical assistants. You'll get to know each one of us very well. That's Sherry, Corey, Amanda, and Alyssa, and they've been with me for years, and they're all very good at what they do, and pretty much knowing my next move, which is kind of scary, that they've gotten to know me that well. But for you as a patient, kind of going through, making everything flow, just making it an easy procedure, even with the follow-ups and the recovery. Our anesthesia team, you know, both of these people, they've been doing this for, I mean, you can read, over 30 and over 25 years of anesthesia experience. And I mean, who better to put you to sleep than Kim Cherry and Jack Daniels, you know? So, you know, there's a lot of people here that are very good at what they do, have a lot of experience, and we try to make this as safe as we can. So here's our office when you come to see us. You know, it's a fairly big building, but like I said, you know, everything is done here, from the consult, the follow-ups, the surgery, the teeth are made, there's a lab here, the restorative is here. So there's a lot going on inside one building, which is good for you as the patient.
It looks like we have a question that came in. How painful is this procedure?
We kind of touched on that a little earlier in the presentation, but you know, it's not. You know, it surprises us. Of course, you're going to definitely know, and I tell my patients that, I mean, you're going to know we spent a few hours together one morning, but pain-wise, we try to cover you as well as we can. I usually do, you know, ibuprofen 800 milligrams, which is a prescription strength, every 8 hours, and then I do give you a prescription for a narcotic, and we kind of personalize that with each patient. But we try to keep you covered where there's no pain. But it's very common for patients to come back after this procedure for the follow-ups and just say, hey, man, like, you gave me, you know, 20 Percocets, and I took one and I really didn't need any more, so I didn't take any more. And that's a very common thing that we hear from our patients who have gone through this procedure. So, you know, it's not, for the work that we put in and the work that we're doing, the procedure itself is just, it's not that bad to go through. So, but that's a good question.
All right, that seems to be all the questions for this evening.
Well, thank you guys for being on here, and I look forward to seeing you for a consult.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.